To end this session 11, let's have a look at some of the practical clinical tips. So the first thing that I would like you to remember is that UTIs or urinary tract infections are quite common and we can go ahead and treat them. But remember that, that the infection does not progress beyond the bladder. Now what I mean is, usually most of the simple UTIs involve only the bladder and the urethra. So the pain is only during urination or after urination, or one of those characteristic symptoms, but the pain never progresses into the back, to the location of the kidneys. So if you have UTI progressing to involve the upper urinary system, which is the ureters and the kidneys, then you've got to be quite careful, and maybe it would be a good idea, if you suspect that whatever remedy you're giving is not working, in spite of say 3 doses, then think of either changing the medicine, or if the disease is progressing and affecting the ureters and the kidneys, then refer them on to a GP. Maybe lab tests and urine culture is necessary. Okay, the reason is, once it goes into the kidneys, then it could end up with a condition called as pyelonephritis. Now pyelonephritis is quite a serious condition which could lead to scarring of the kidneys, which you really don't want. Now that's one point. And another point which I'd like to tell you is that make sure that the condition is, you have some good symptoms and you're not prescribing on just one symptom, like pain at the end of urination and your brain just jumps to the medicine, or giving cantharis for every case of cystitis. Don't do that. What would happen in that case is, you're not going to get a good result, and that patient with the cystitis is going to definitely, the condition is going to progress, become worse, and in all probability they might need antibiotics at the end of it. So wait until the case is, the remedy, the remedy picture is very clear. That means the case is clear before you prescribe. Okay. Now, according to Morrison, cystitis is one of the most common acutes to develop when you're treating the patient holistically as a constitutional treatment. Now, personally, in my clinic, I generally find a lot of, not so much of cystitis under constitutional treatment, but I would find, a cold, a bad cold with a lot of nasal discharges, or maybe some kind of a rash. Okay, now moving on, remember that cystitis is a self-limiting condition, but if it's accompanied by fever, back pain or other systemic symptoms, it may be pyelonephritis, which is an inflammatory kidney condition, and that's what I told you, it could lead to scarring of the kidneys. So be careful of that. So no back pain. If you see a back pain, do a differential then. Now, if lab test results are negative, that means the urine is sterile, but the patient says that they have symptoms of cystitis, then it may be indicative of urethral spasms or genital herpes. Now, it doesn't matter whether it's urethral spasms or cystitis, because the symptoms for both would be the same, and hence the same homeopathic medicine may be used for either one of those conditions, either urethral spasms or cystitis. Now, if a person has got recurring bladder infections, that means more than 3 infections a year in 1 or 2 years, this may be a sign of structural abnormalities. yeah, or it could be a sign of malignancy, or they might be chronic stones. So you need to refer them on to a urologist. Now, recurring bladder infections may also be due to bad, just keeping by bad habits. What I mean is, if you need to go to the toilet, if you're not voiding, if you're not going to the toilet, yeah, you just hold on to it, then what happens is this retention of the urine, and that could lead to infection. Yeah, so don't wait and try to train your bladder, as I've heard some patients say. Yeah, if you need to pee, just go and pee. And remember, UTIs are more common in women than in men because the urethra is shorter. Yes, so especially in women, make sure that they don't hold on to the urine. Okay, now other practical tips that you could give the patient is, increased fluid intake, and also increasing vitamin C intake, and having unsweetened cranberry juice. Remember, most of the cranberry is actually not a very sweet one, but what we get in the market is always sweetened. Yeah, so avoid the sweetened version because that could make your cystitis worse. So have the unsweetened cranberry juice if possible. Now, in children, cystitis may be due to, unclean habits, or not being able to, they haven't yet learned to wipe back to back and front to front. So practice of clean hygiene is important, and also avoid letting the children have bubble baths at this time. Now, other self-help things would be, like dandelion, stinging nettle teas, yeah, or even uva ursi tea, or inclusion of garlic capsules. These are all things that self-help things that the patient can do. Now, coming on to posology, according to Morrison, 30C every 2 hours until symptoms subside. And if there is no improvement after the third dose, medicine is incorrect. Take the case again, prescribe another medicine, or refer them on. And he also goes on to say that a 200C may be given if the symptoms are very clear and you're confident of your remedy selection. You can go ahead and give a 200C. Generally, in my clinic, what I would do is I would give a remedy, and I would base whether it's a 30C or 200C would be based on the vitality of the patient, my calculation of the vitality of the patient, and I would give either 30C or 200C. But the way I would do it is not every 2 hours. What I generally do is to take it after every time they pee. If they've peed, there's burning, take the medicine. The next time they need to go to the toilet, they pee. If there is no burning, then they don't take the medicine. So it's a kind of self-management. So maybe the first day they need to take it quite often. Yeah, but then as the medicine takes hold and they're better, they don't need to take that much, and they would automatically reduce the number of administrations. Now, in this, make sure that you have a very, very quick follow-up. Yeah, almost within, say, maybe 12 hours or 24 hours, latest by, have a follow-up, check up with the patient, what's happening. If there is improvement, great. If there is no improvement, you have to think of either changing the medicine or referring.